Hi, I'm Dr. Langley with Pine Ridge Family Medicine. I am at 36 weeks pregnant for those of you following along. Still pregnant, doing well, feeling swell. But this week I wanted to talk about preventative health and taking care of yourself in a preventative manner, just not reacting to your new diagnosis or whatever is hurting or going wrong in your life, but being able to prevent disease. I mean, how much better is it to do something to prevent getting cancer than to get cancer and have to go through all the treatment and chemo and radiation and surgeries if you could avoid that by detecting it early in the first place? And like with skin cancer, just a little snip snip, remove the cancer before it gets big and awful, and that is so much better. But I mean, okay, so we're on the same page. We've heard of preventative health care and you want to do it. How do you know what to do? You're a 56-year-old male. What do you need to be doing to best take care of yourself? How do you figure that out? Who do you believe? Because one of the things that I hope that you've heard about, especially with the coronavirus pandemic, is that there are different medical organizations out there and they do have different opinions on when you should do things. So just for example, a really common conversation I have with my patients is about mammograms. So there are some really good organizations that recommend starting at age 40, get your mammogram every single year, starting at age 40. There are also some really good organizations out there that say start at age 50. Actually, 40 is too young. Start every year at age 50 and then every year get your mammogram. How in the world do you know which one? Well, hopefully you have an excellent relationship with your primary care provider, and that they're a direct primary care doctor that can spend a lot of time with you and have these conversations about what are your worries? What is your family history like? What has been your experience with breast cancer? How big of a priority is this to you? Because on the one hand, detecting cancer early is so much better than finding it later. But then on the other hand, if you're looking for something, you're more likely to find something. Meaning that if you get your mammogram starting at a younger age, and you're starting at age 40, for example, your breast tissue is just more difficult to see through. It's more dense. Your breasts change a lot over the course of your life, and 40-year-old breasts look a lot different than 50-year-old breasts. That's a normal and healthy thing. But that means that it'll be more difficult to see through on the mammogram when you're 40 than when you're 50. So there's more of a chance for them to not be able to see something very clearly and say, let's just be on the safe side. Let's get another view, or let's get an ultrasound, or let's get an MRI, some other modality to get a better view of that, which means they're more likely to find, so, I mean, that's stressful in the first place when you get your mammogram done and they say, come back. Oh, your heart begins to flutter, you start to panic a little bit, wondering what could be going on. Or they might even recommend a biopsy to be absolutely sure if they really can't see that spot. Let's just put a needle in that spot to make sure that it's not, we can actually look at the cells that way. And when you look at the cells, you can tell if they're cancerous or not. So that's a really good way of ruling it out. But oh goodness, seeing my patients go through breast biopsies is a scary thing. They're very scared and nervous, and it's a little bit traumatic. I mean, it's not an easy procedure. It's a little bit painful, and it's very personal, and then you're waiting for those results to come back, and it's a scary time in many of my patients' lives. So then they find out that it was all nothing, and then, or I mean, on the other hand, they find out that it's cancer and it saves their life. Or they find out that it was all for nothing, that it was nothing in the first place, and it was just normal tissue that they happen to not be able to get a good view of. So was that early mammogram worth it? That's a really tough one. If you come back with all normal results, are you going to look back and say, I should have definitely gotten that mammogram at age 40 on the off chance that it would catch cancer, which is a very good goal, but instead it added a whole bunch more stress and worry. And stress and worry, I don't want to brush those aside either. Stress and worry detract from your life maybe for weeks to months at a time when you're waiting for your results and waiting for procedure after procedure like that. And I think those weeks and months are valuable. So it can be a really tough decision of when to start doing those screenings and who to trust, what medical organizations to trust with your personal health. So hopefully you can talk about this with your medical provider, with your doctor who knows you well, who knows your priorities well. Some of my patients, I know right off the bat that they will do any kind of screening to stay alive for as long as physically possible and as healthily as possible. I can totally see where they're coming from. I also have patients that just want to live their life to its fullest, and then when it's over, it's time to be over, and they're not going to sweat it. I can totally relate with them too. So having those thoughts about your own life is important too. And it can be different for different medical conditions. It can be that, man, prostate cancer is my number one fear. I want to know what's going on with my prostate exactly. I want to know my PSA. I want to get imaging. I want to get biopsies. Nothing else is as important to that as that to me. That can be your position. That's okay. But maybe when it comes to your heart, my heart's going to go when it goes. So being on all the medications maybe not be my favorite thing. Going to all the different cardiology visits that I could may not be a priority to me. You're allowed to have your own opinions on that for your own life. But it's also important to be educated on what you should be getting done. So I like to approach it from more of a conservative, what are the really basic things that we should really be planning on? We can always go above and beyond for things that my patients are anxious about or that have those things running in their family. So I like to rely on an organization called the United States Preventive Services Task Force, USPSTF. Whew, it's a bit of a mouthful, and I always tend to forget exactly the acronym. So that is it. They have a wonderful calculator that you can find down in the comments down below, that you type in your age, your weight, your height, your gender, whether you're pregnant or not, whether you've ever smoked tobacco or used tobacco, chewed tobacco, and whether you're sexually active. And based on those basic demographics, what you're due for, what is recommended, whether you should be getting mammograms or prostate exams or pap smears or bone density checks. I mean, there's just so many things out there that I really have compassion for my patients that just feel lost. I mean, there's all the different cancers you could screen for: cervical cancer, breast cancer, ovarian cancer, colon cancer, lung cancer, skin cancer. I mean, should you be going in every single year for a total skin check? Should you be going in every year just for a physical? Is that something that a 22-year-old male with no medical problems should be doing? You don't have to, by the way. I'll give you that answer right off the top of my head. Is that an annual physical for no other reason, if you're totally healthy, has not been found to find anything or do any particular things for you. It can be useful if it's hard to get in with your doctor so that you have the chance to touch base with them and actually see them. But if you have access to a direct primary care doctor and can see them on a regular basis pretty fast and have a good relationship with them already, you don't necessarily have to come in every single year just for that physical. So check out this calculator. I think that it could be really useful for you to make sure that you're doing all the right things, but not too many of the right things, too many of the things that you don't necessarily care about. Going in every year and getting your carotids ultrasounded, for example, I think is a big waste of your time for most people. But there are people out there that want to take your money and will encourage you to do exams that you don't need and might even lead to further exams down the road that cause stress and pain and aren't worth it at all and aren't recommended. So whenever you hear about, hey, you need to have your aorta ultrasounded to make sure that you don't have an aneurysm, something like that, no matter what setting it is, it's a nice thing to double check. Check on the USPSTF website to see if that's something that's actually going to be useful to you. If it's going to make you live longer or live better, okay, let's see. Let's type in your age and gender and all those other information and see if this is a recommended exam. You can even look it up by just that exam to see who it would benefit if you fit into the criteria for someone that would benefit from having an ultrasound done of their carotids or an ultrasound done of their aorta to check for an aneurysm. So just trying to do a little bit of education today. Thanks for watching so much. I have another video on a similar topic right there that might be interesting for you to watch. And please hit the subscribe button there. And then you'll be notified of when we have new content. Or maybe I'll go on maternity leave and won't have new content for a little while. We'll see. But yeah, hope you're having a great day. Thanks for watching.